teach me how to use the thing, right? And we could use the other spacers. Wouldn't this make your life so much better if we use this spacer? Because this spacer this spacer here, all you have to do is plug it in. But with your spacer, you have to take this out and plug it into that, right? So it's a little different step on there. Okay, so my job, what I've been ordered to do, is come and teach this gentleman how to use his meter dose inhaler and his peak flow meter. Okay? Mr. Malunao?
Yes.
Hi, I'm Steve Wehrman. I'm from Respiratory Therapy.
Okay.
How are you doing today? Anxious to go home.
I want to go home.
Great. Yeah, well, that's why I'm here. Your doctor asked me to show you how to use your breathing medicine before you go home. That way, I'm going to keep you out of the hospital, huh?
Okay.
Let me just check your ID. Oh, yeah, that's you. Nice picture. Okay. How's your breathing feel?
A little bit of wheezing right now.
Okay, feel a little bit tight?
Yeah.
Have you ever seen one of these before?
No.
Okay, this is called a peak flow meter. It's like a speedometer for your lungs. It'll test how fast your air can come out. When you're tight, it'll come out slower. And because it can measure it, it can help you decide when to take your breathing medicine.
Okay.
So here's the handle. It goes like this, and it slides on like this. So why don't you take it apart? Yeah, there you go. And then just pull the handle and fold it back. That's great. I'm going to set that down for a second. And I need to calculate what your normal volume is, what your peak flow is. So why don't you tell me how tall you are?
I am 5'7".
5'7", 67 inches. Okay. And how old are you?
35.
35. Okay, so we would guess that you would need about 600. Okay, so we'll set your goal. Your goal will be 600. Okay, half of that is 300, right?
Yes.
Okay, and 80% of 600 is about 480. There we go. Okay, so the way I have this set up, there's going to be 3 zones: red, yellow, and green, just like in a stoplight. Green means go, yellow means caution, red means stop, get help. Okay, so we'll use that. When you blow into it, this thing is going to go up. If it goes up into the green, you're good to go. Okay? Just take your Advair, right? That purple thing, right?
Right.
You just take that. You take that every day no matter what. No matter if you feel good or not. That controls your asthma. Okay? If you're in the yellow zone, we're going to take some quick relief medicine called albuterol. That's the one I've been giving you in those breathing treatments.
Oh,
Is
okay.
albuterol. Okay? If you're in the red zone, it means to take your medicine and then call 911 or get right to emergency care.
Okay.
So I'll have you blow into this thing, okay? And we do it 3 times. We'll blow once. We'll look at the score. We'll blow again. We'll check it 3 times to make sure we're getting a good score. So we've got it, and we'll take the best score. Okay. So now to do this, you hold it in your hand. You're going to take a big deep breath. Don't do it yet. Take a big deep breath in. Put your lips around the mouthpiece and blow through it as fast as you can, like this. Okay, so take a deep breath and blow. Good. Okay, and what's your score? Can you read that?
It's 560.
560, right. So now push this back down. That was in the green zone, right? Okay, let's take a big deep breath and blow again. Very good. And read your score. Oh, wow, 550. Okay, one more time. Okay, now take a really big breath and blow really fast. Oh, look at that, 600. Okay, remember we said 600 was like perfect for you, right?
Yes.
Okay, so if you're up here in the green zone, you just take your regular Advair, your controller, right? And you don't have to take this.
Okay.
But let's say that you ended up in this zone, right? Okay, in the yellow zone. And what you would do is take 2 puffs of that,
2 puffs.
wait 20 minutes, and take this score again. If you get up in the green zone, you are good to go. You stay in the yellow, you're not opened up yet. You need to take 2 more puffs. Wait 20 more minutes, blow into it again. If you're green, good to go. You stay in the yellow, you're going to take 2 more puffs, wait 20 minutes, and blow into it again. So over the course of an hour, you'll take 2 puffs every 20 minutes. So you'll do it 3 times to open yourself up. If you tried 3 of those treatments and it doesn't get you out of the yellow zone, you need to call your doctor.
Okay.
Now, if you're feeling really, you're going to notice if you're in the yellow zone, you're probably feeling tightness in your chest and wheezing, you're coughing. So there'll be symptoms that go with it. Right?
Okay.
Now, if you are really bad, really tight, you're going to end up in the red zone. And that's going to be really bad. And that means you take your 2 puffs of medicine and you either call 911 or you get a friend to take you, because we don't think you should drive when you're having that much trouble breathing. Okay, so what do you do if you're in the red zone?
In the red, call 911 or have somebody drive me to the
Right. Get help immediately, because we don't want you to end up having something really bad happen with your asthma. So if you're in the red zone, that's a warning that you got to stop what you're doing, take your medicine, and seek help immediately. Okay? Okay, so that's the peak flow meter, and we'll go over that again at the end. Now I want to teach you how to use the medicine. Of course, it comes in this box, and if you like to read fine print, there's a lot of really good stuff in here. Okay? Now, your inhaler comes with a cap on it to keep stuff out of there. Sometimes if you put it in your pocket, you know, like dirt or stuff get in there, and we don't want that to blow in your lungs. So I'm going to take the cap off. And there's just 2 things you need to know to be ready to use it. You have to shake it. That mixes the medicine with the stuff, the propellant that sprays it out. So you want to shake it up like salad dressing. If you don't mix it up, it won't taste good, right? So you want to shake it up until you get a full dose of your medicine. And then when it's brand new, or if you haven't used it for a whole day, then you need to prime it like a pump. So there's a little chamber in there that holds the medicine, and by priming it, it'll have the right dose for you. So I'm going to puff this for you. I'm going to push down on it to puff it. And there comes the medicine. It shoots out, right? So I shook it up and I primed it. So now it's ready to go. Okay. So I have a special device for you here. Now you can actually put this in your mouth and breathe in and puff it at the same time if you don't have your spacer. But this works so much better. Okay. So I'm going to get your spacer out. Oh, it's brand new. It's great. Okay. And we'll put the mouthpiece on here. And this thing is a whistle. The whistle will tell you if you breathe in too fast. And the idea is to breathe in slowly and deeply till your lungs are full, and then hold your breath for about up to 10 seconds, 5 to 10 seconds, so the medicine can settle in your lungs and deposit it, not just come back out again. Okay, so this thing is called a holding chamber. It holds the medicine for a second or 2 so that you can breathe it in properly. So you don't have to time how to breathe it in. So I'm going to take this off of here, and I'm going to do the first one, and I'll have you do the second one. See that little hole in there?
Yes.
Just stick this thing in here like this, okay? Okay, now, before you use it, you shook it and you primed it, okay? So it should be ready to go, but always shake it again. Before you take a breath off of it, always shake it up to make sure the medicine is mixed. So now what you do is you are going to breathe out. You're going to put your mouth on this and blow into it gently, just blow out some of your air. Then we're going to puff it and take a big deep breath in and hold it, hold it, hold it, and get that medicine to settle, and then you can breathe right back out through it. Okay? If you hear a whistling sound, it means you breathe in too fast. So I want you to put your hand on here, okay, and I'm going to help you with this since I know you've never done this before. Okay, so put it in your mouth and blow out. Puff it, and now breathe in. Hold it, hold it, hold it, and let it out. Good, excellent. Now, we don't really want you breathing in this medicine, Jess. So I'm going to activate the thing, and you're going to do the breathing part. Okay? We could put a filter on it too. Okay, so here we go. Shake this up. Oh, I want you to demonstrate, see if you remember everything. Shake it up, okay. Mm-hmm. Okay, puff it, and now breathe in. Good, and hold it, hold it, hold it, hold it, and let it out. Excellent, good job. Now when you guys are doing this to practice, if you're using real meds, just go like this. Hold it, hold it, hold it, right? Okay. Well, that was very good, Mr. Maldonado. So I'm going to put this cap back on here. I'm going to put it back in the box with the instructions, so you can always refer to that if you have any questions.
Okay.
Now, sometimes people ask me about cleaning this thing. You just take the ends off of it, rinse it out with water, and let it air dry. Shake it out and let it air dry. You don't have to wash it with soap or do anything special with it. Okay. The mouthpiece, if it gets, you can clean that off. Just scrub it a little bit like a. Don't put it in the dishwasher; it'll wreck it. Okay. So you hand wash it, and then if you want to use soap, that's fine. But make sure you rinse all the soap off, and just lay the parts on a paper towel and let it air dry. That'll make sure that there's no germs or anything. Although it really doesn't get germs in it. Okay. Now, in terms of this thing, if you use this like this, one thing that can happen is that little